It's time for Back in a Minute. Can Dr. Kornel explain anatomy in less than 60 seconds? Ready, set, go!
So tonight I'm going to explain Chiari malformation or cerebellar ectopia. So the cerebellum is the back part of the brain that helps control coordination. And part of the cerebellum are called the tonsils, and they sit on top of the opening in the skull called the foramen magnum.
These are not the tonsils in your throat.
Not the tonsils in your throat.
The brain tonsils.
Don't interrupt me.
So you can't have these tonsils removed.
Mr. Knight, stop interrupting me.
No ice cream for these tonsils.
So the spinal cord runs through the foramen magnum, and the cerebellar tonsils sit on top of that. But sometimes the cerebellar tonsils poke through the opening, the foramen magnum, and when they do, that's the tonsils in a place they shouldn't be, or cerebellar ectopia, or known as Chiari malformation.
And that is Chiari malformation. And we're doing back in a minute earlier tonight because the whole show is about Chiari malformation and whiplash, right?
And we made it in under a minute.
60 seconds. Unbelievable.
So we're going to talk about brain tumors. There are a variety of different brain tumors, and of course it's very scary for anyone when they hear the word brain tumor. Some of them are benign, such as a meningioma. A meningioma is a tumor that comes from the lining of the brain and not the brain itself, but it presses on the brain, and it is a benign tumor, and when it's removed, most of the time it can be cured. There are other benign tumors that occur within the brain, such as ependymomas, pituitary tumors, but there are also malignant tumors. The most common ones these days are probably metastatic tumors, or tumors that come from somewhere else. A cancer that comes from the lung or the breast can end up in the brain. And often it's multiple tumors, and those need to be treated immediately. And often we use a treatment called a gamma knife for that. And then the most worrisome tumors are the tumors that arise from within the brain themselves, and they're called gliomas. The most severe of those is a glioblastoma.
In 60 seconds, you just did brain tumors?
Well, we've got to talk more about that, and we'll devote a whole episode to that.
We definitely should, but that was very impressive. You got that all in 60 seconds. So
it's my job.
Congratulations, Dr. Kornel.
Actually, the previous call was very appropriate for this because we're going to explain what epidural steroids are.
Okay.
Epidural steroids are injections into the spine in the space called the epidural space. The epidural space is the space in the spine between the bone and the lining of the spine around the nerves. So it's not an injection into the lining to the nerves directly. It's an injection into that epidural space. And it's an injection by a steroid that isn't the type of steroids that athletes take to build up muscle. It's the steroid that reduces inflammation. And it works because there's a lot of inflammation around arthritic joints and around discs that are degenerating, and that contributes to the pain. So an epidural steroid injection may reduce the inflammation and may well reduce your back pain, as the former caller pointed out so well.
Well, that's very interesting. So if you take these steroid injections, you're basically men are not going to grow breasts and women are not going to grow beards.
You're right.
Well, you made it in under a minute, so congratulations.
Myelopathy is when there is compression or damage in the spinal cord. The spinal cord, of course, is the main nerve that comes from the brain down the spine that sends all the nerve fibers to your arms and your legs, controls movement, controls feeling, controls bladder and bowel. And when the spinal cord isn't functioning properly, you have what's called a myelopathy. And that could be due to many different things: compression of the spinal cord, tumors of the spinal cord, arthritis in the spinal cord, multiple sclerosis. Many things can cause it. So that, in a nutshell, is myelopathy.
Well, you did very well. Medical school in 60 seconds. Congratulations, Dr. Kornel. You win a big heap of nothing.
I don't deserve anything today.
You didn't prepare. That's okay. Dr. Kornel is running for a cause. More in a minute. And you can download a podcast of this show starting tomorrow and read more about tonight's topic and how to keep your back in good health. It's right on our website, backtalkonair.com. We will be right back.